So I know I've given you a lot of information today. There's a lot of details that we've gone through. I just want to make sure that you understand what we've gone through. So why don't you tell me at least what you've gotten out of this consultation today?
Okay, it seems that the cancer is advanced, and you feel that there should be some action taken, either surgery or radiation. I think your leaning was toward radiation, if I'm not mistaken.
I think there's two things. I don't want to give you the perception that this is an advanced cancer. To me, that implies it's not curable. So I want to reinforce again that while this is something I do recommend treatment for, it still appears to be very curable. So I wouldn't think of this as advanced. And I just want to reinforce it. It's good that you're asking questions. Questions are a wonderful way to get information and to clarify points that sometimes doctors use terms that just aren't understandable. So please ask questions anytime you like. And do you have any now?
What if I chose no option, just to not do anything?
But I just wanted to reinforce that, based on your clinical information, the biopsy, all that we know right now, that your initial decisions will be whether you want to pursue a course of radiation therapy or whether you want to pursue a course of surgery. And certainly gathering the information that you need is appropriate. If you decide on radiation therapy, really the next step is to meet with a radiation oncologist. And they will specifically outline the plan. It usually involves getting what's called simulated, where they position you on a table so that they can make sure they're targeting the prostate appropriately, and then they'll start the course of radiation therapy. For surgery, the initial thing that we would do is make sure that you're appropriate to go to the operating room. So because of your heart history, we would make sure that you contact your cardiologist, and we would also do a series of x-rays just to make sure that even though I think your cancer is confined to the prostate, that we have more information to assure us that that's so. So that's why I mentioned the endorectal MRI and a bone scan. And once that information is available, then we can go ahead and start thinking about a date to perform the operation. You should have made your decision and at least have the treatment plan in place so that you can initiate therapy. Okay. Any other questions before we finish?
No, I think you've covered everything.
Wonderful. Okay. And if anything else comes up, just give us a call. We'll be happy to talk to you.
Thanks very much.
You're very welcome.